So the question is about carotid cavernous fistulas, and a carotid fistula is the carotid artery, and the cavernous sinus is the venous component, cavernous sinus, which is like the big vein, and a fistula is an abnormal connection between the artery and the vein, which is like with unlike. That's a fistula as opposed to a shunt. So a CC fistula is an abnormal connection, cross-section through the cavernous sinus, internal carotid artery, which is the artery, and the big vein is the cavernous sinus. Inside here are cranial nerves in the wall, and the one that's inside the substance is 6, otherwise all the other ones, 3, 4, B1, and in the posterior portion of the cavernous sinus, B2, are all in the wall. And so it presents to us as cranial neuropathy, diplopia, but because you got anterior flow into the superior ophthalmic vein, then you get the red eye and arterialization of flow and the corkscrew vessels and proptosis and lidity. However, even though we call things right and left cavernous sinus, they're connected. And so you can have a carotid cavernous fistula that's ipsilateral, which is the most common because the blood flow just takes the path of least resistance. It can be bilateral because the flow can go to both sides. And amazingly, it can be contralateral. And the reason it's contralateral sometimes is because you have thrombosis that changes the flow. So normally the flow anterograde and posterior into the inferior petrosal sinus. And so if you have thrombosis on that side or thrombosis of the cavernous sinus, then the fistula still has to drain somewhere, and that means it might drain to the contralateral side, and all the findings could be on the contralateral side. So even though most of the time it's ipsilateral, sometimes it's bilateral, and sometimes contralateral. You cannot tell which side the fistula is on without doing an angiogram. And that's because the flow is what directs the symptoms and the signs. And the flow is determined by thrombosis in carotid cavernous.